Evening, everyone. Welcome to our Public Health Roundtable for Common Start, Building Blocks for a Healthier Future. My name is Allison Parandrag. I am with the American Heart Association, and I'll be introducing our panel members shortly. I just wanted to give a few reminders. Tonight, we have interpretation services in Spanish, and in a moment, you'll see a globe icon with the word interpretation at the bottom of your Zoom screen. If you're joining from a mobile phone, you'll need to click on the button with the 3 dots, and then you'll see the option language interpretation. Everyone must choose the language in which they want to participate, English, and clicking on the globe. To listen to the meeting in Spanish, click on the globe icon at the bottom of the screen and choose the Spanish language and stay on the channel, please. I don't know if our interpretation services wants to say that in Spanish for me.
Bienvenidos a todos. Esta noche tenemos servicios de interpretación en español. Usted en un momento verá un icono de un globo en la pantalla con la palabra interpretation en la parte inferior de la pantalla de Zoom. Si usted se une de un celular, tendrá que hacer clic en el botón de los 3 puntitos y entonces verá la opción Language Interpretation. Todos deben elegir en el idioma en el que desean participar. Gracias.
Thank you so much. We're going to go over kind of what Common Start is, then we'll go into our presentations, then we'll have a little bit of a panel discussion. But along the way, if you have questions, please put them in the chat and we will have time to answer them at the end. Again, this is being recorded and we thank you for coming tonight. James, if you want to start the slides, that would be great. So I'm sure most of you on the call know, but the Common Start Coalition is a statewide partnership of organizations, providers, and parents, early educators, and advocates working together to make high quality early education and childcare affordable and accessible to all families. We're currently at 136 groups and we're still growing. So if you're not part of the group, please join us. Our goal is to ensure that all families have the care solutions they need and that the children in the Commonwealth have the same strong start and enter school in a level playing field. During the immediate recovery from the pandemic and over the long-term, access to affordable, high-quality early education and childcare is critical to building stronger, more equal, and just Massachusetts. The Common Start Coalition is committed to making this vision a reality. Next slide. The Common Start legislation would establish a system of affordable, high-quality early education and childcare for all Massachusetts family over a 5-year timeline, increase education attainment and lifetime earnings, and long-term health benefits, including improvements to children's brain development, will all come if we pass this legislation. Next slide. Our panel tonight is really focused on health and why these particular groups are supporting the Common Start legislation. We know that by teaching children important lifelong skills and healthy habits at an early age, a comprehensive early childcare programs will help set students on the right path. Research shows that participants are more likely to graduate high school, attend college, and live healthier lives. Kids need these building blocks for a healthy life. Thanks so much. So as I was saying, 60% of kids under the age of 6 spend majority of their time in early childcare programs. So we know that that makes it easy to agree that children deserve the benefits of a healthy environment when they're learning the skills and habits that will stay with them into the adult years. Next slide. We have a really great panel tonight, and I'm really excited to welcome my partners from the Mass Nurses Association and the Boston Foundation. I'll give a little bit of introduction and then they can go into more details about their own organizations. So as I mentioned, my name is Allison Parandrag. I'm with the American Heart, American Stroke Association. I'm the Government Relations Director and the regional lead for them. My role is really to manage, plan, and direct our advocacy programs. We influence local, state, and national public health issues related to our mission, both, and I cover Massachusetts, Maine, and New Hampshire. We really do this by mobilizing volunteers, staff, and coalition resources. We achieve issues, and I have been part of many legislative accomplishments, and I look forward to working with many of you tonight to make sure that we have high quality early education that's affordable and accessible to all families. Katie Murphy is the president of the Mass Nurses Association. She's a registered nurse and works in the medical ICU at Brigham and Women's Hospital. She has a Master of Science in Nursing and is certified in Critical Care and Neuroscience Nursing Care. Katie was elected president of the MNA by her colleagues across the Commonwealth in 2020, after serving for 10 years on the board of directors. She has previously served as the vice chair of the MNA's Political Action Committee and has testified on Beacon Hill many times on subjects ranging from safe patient limits to access to essential healthcare services. Brianna Savage is a nonprofit and public policy professional working at the Boston Foundation for over 2 years. As a public affairs associate, she tracks, analyzes, and integrates relevant legislation into the foundation's work. Brianna continues to monitor bold legislation in the greater Boston area that will work towards advancing equity and inclusion, especially for those historically disenfranchised in the region. While working at the Boston Foundation, Brianna is also obtaining a Master's of Public Administration degree at the University of Massachusetts, Boston, with a Gender Leadership and Public Policy certificate. Danuba Camargo Silva has dedicated many years of her professional life to advocating for systematic change that can have a profound effect on children and their families. She joined the Boston Foundation's Education Health Team in the fall of 2021. After serving as a program director at a national organization serving single mothers and their children and disrupting intergenerational poverty. Danubia continues this work through the Boston Foundation with the goal of creating a more equitable and healthy early childhood experience for Massachusetts children and their families. Danubia has served in several advisory roles in the greater Boston and has a master's in education from the Harvard Graduate School of Education. Next slide. So for those that don't know, the American Heart Association is the nation's largest voluntary health organization fighting heart disease and stroke. For nearly a century, the Heart Association has been working to create a world free of heart disease and stroke. We make a difference in the lives of millions of people, and our work is more vital now more than ever. As we approach our centennial, we're taking bold and decisive action to address health equity and guiding our efforts to the AHA's 2024 impact goal, which is every person deserves the opportunity for a full, healthy life. As champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. The AHA has been a longtime champion for equitable health and well-being, and we are dedicating our time and resources towards achieving our commitments to drive health equity. Our mission is to be a relentless force for a world of longer and healthier lives. And we believe that starts as early as birth. And so that is really why our focus has been around early education in the last few years. Next slide. We believe that the environments we create and the experiences we provide for our young children and their families affect not just our developing brain, but also so many other psychological systems, including heart and lung function, digestion, fighting infections, and physical growth. Investing in affordable, accessible childcare can ensure that our children are growing up in environments that makes them healthier for them. Next slide. We have a number of things that we work on, and we support policy changes that ensure that all children will grow up to be healthy where they live, learn, and play, because we believe the environments that we create for young children can impact many aspects of their physical health. Heart disease, type 2 diabetes, and depression are the three most common and costly chronic disease experienced in adulthood. And they share a common association with elevated inflammation, which can trace back to trauma experienced in childhood. According to a Prenatal to 3 Policy Impact Center, healthy parents who are equipped with the resources and skills necessary to care for their children are likely to engage in higher quality interactions with them. Adequate household resources, parents' ability to work, and healthy parenting skills help create nurturing environments that children need. Household economic security is important to ensure healthy infants and toddlers, and experience of financial hardship during early child care can disrupt healthy brain development. It's important for our parents and caregivers to receive the social systems that they need, as this can impact their health and well-being, which influence their interactions with the infants and toddlers in their care. Nearly half of all parents with children under the age of 6 have searched or are searching for childcare for personal or child development. 2/3 of parents have searched or are searching for childcare for at least one parent. could work or attend school. 66% of parents have searched or are searching for childcare so at least one could work or attend school. And nearly 1/3 of parents have searched or searching for childcare to help with the child's learning and development. 30% of US parents have searched or are searching for childcare to help with their child's learning and development. Sorry, I'm repeating myself. Parents from higher income households were more likely to search for childcare compared to parents with lower income households. And parents from lower income households were less likely to search for childcare. 51% of parents from higher income are also searching. This is why more than ever that we are to support important legislation like Common Start to ensure that we are making sure that childcare is accessible and affordable. I'm now going to turn it over to Katie Murphy.
Thank you so much, Allison. It's really an honor to be part of this very important conversation. I think I'll start with the first slide, who we are, just a little bit about the Massachusetts Nurses Association. We're the largest union and professional association of registered nurses and health professionals in the state, and the third largest in the nation. We represent more than 23,000 nurses and healthcare professionals working in 85 healthcare facilities. This includes most Massachusetts hospitals, 52, as well as schools, visiting nurse associations, public health departments, and state agencies. We were founded in 1903 and we have created or helped pass nearly every standard and state law governing nursing practice in Massachusetts. This includes the Nurse Practice Act, the RN license designation, a uniform curriculum for the education of nurses, the first code of ethics, the prohibition against mandatory overtime, ICU safe patient limits, and the law allowing nurses to unionize. We unite as caregivers and with people in our communities to win strong collective bargaining agreements, pass legislation, and support common causes to improve the health and lives of our patients and the public. Next slide, please. We are proud to be part of the Common Start Coalition because affordable, high-quality early education and childcare is foundational to public health. Massachusetts Nurses Association nurses and healthcare professionals are committed to helping build a stronger, more equal, and just Massachusetts. We approach this commitment by working to improve conditions inside healthcare facilities for staff, patients, and patient families, but also in other ways. We represent school nurses who promote student health, empower student development, and help contribute to academic success. They connect healthcare and education and create systems that allow individuals and communities to develop their full potential. We represent clinicians at state-run medical, mental health, and developmental disability agencies that serve diverse and often vulnerable populations. Our members also care for children and support their families in acute care hospitals and mental health units across the Commonwealth. M&A nurses work in maternity and pediatrics. We have experienced the toll that reduction in healthcare access in these areas has taken on families. Next slide, please. In our M&A bylaws, we state that we are committed to upholding the highest standards of care while protecting our members and the communities that we serve. The M&A has a standing diversity committee, which in early 2021 began an organization-wide effort to educate and mobilize M&A membership to confront structural racism and its impact on the nursing health professions, the healthcare workplace, and the broader society. We're committed to contributing our voice and actions to all groups and individuals working for the dismantling of structures and policies that enable and support continued disparities in health outcomes. As the pandemic unfolded, we watched as community members of color and those from poor and disadvantaged communities filled the beds of Massachusetts hospitals, again, bearing the brunt of disparities created by deeply entrenched systems that foster unequal outcomes and treatment. Next slide, thank you. We've seen significant increase in the complexity of care patients require over the last several years, even before the pandemic began. Patients have more comorbidities and increasingly suffer from behavioral health and substance use disorders. Without an adequate social safety net, early childhood education and care, and without universal health care access through Medicare for all, people are at much greater risk for physical, mental, and emotional health problems. Research suggests that many disparities in overall health and well-being are rooted in early childhood. For example, those who lived in poverty as young children are more at risk for leading causes of illness and death and are more likely to experience poor quality of life, according to the CDC. Early childhood programs are a critical outlet for fostering the mental and physical development of young children, according to a review published by the American Journal of Preventive Medicine. And the Carolina Abecedarian Project, one of the oldest and most cited studies of early childhood education programs, found that children who participated in a high quality and comprehensive early childhood education program, including healthcare and nutritional components, were in better health than those who did not. The study found that at age 21, people who participated in a comprehensive early education program exhibited fewer risky health behavior. They were less likely to binge drink alcohol, smoke cigarettes, and use illegal drugs. By their mid-30s, children who participated had a lower risk for heart disease and associated risk factors, including obesity, high blood pressure, elevated blood sugar, and high cholesterol. Next slide, please. Nurses and healthcare professionals see at the bedside on a daily basis the impact of families not having access to high quality, affordable early education and childcare. This affects all of us. It affects the children and adults we care for as patients, and it affects all aspects of our society. We have the resources in Massachusetts to fix this problem and ensure every child has a healthy start in life. By working together, we can make real change that positively impacts children, families, and our entire state. And we look forward to the fight. Thank you.
Thanks, Katie. Brianna, I think you're up next. Next slide, James.
Hey, everybody. My name is Brianna Savage. I can go right to the next slide, James. Thank you. Hi, I'm Brianna Savage. I'm the Public Affairs Associate. Thank you, Allison, for the introduction before. And Katie, it's so nice to hear you speak about these issues. I'm joined today by Danubia Carmago Silva, who's our Program Officer for the Early Childhood Program. And I'll start right ahead and just kind of giving you all an introduction into the Boston Foundation. So the Boston Foundation is one of the oldest and largest community foundations in America. And being a community foundation, our role is really to answer the needs and the current issues of the region. Our region is in that kind of 95 belt of the greater Boston area. We partner with community members, donors, the public sector, businesses, and nonprofits, and we serve as a civic leader for our city and region. In this role, we publish research into the most critical issues of our time, convene large groups of people to discuss the city's agenda, and use our shared knowledge to advocate for public policies that promote equity and opportunity for everybody. The Boston Foundation is also one of the largest grant makers in New England, providing support to nonprofit organizations in Greater Boston through our endowment and working closely with our donors to support nonprofits locally, nationally, and internationally. Okay. Sorry, didn't know if I needed to pause for translation there, or interpretation rather. So part of the Boston Foundation's way that we answer the needs of the community is focusing on these impact zones. Sorry, James, do you mind going back to the previous slide? Thank you so much. Focusing on these impact zones written here, the education and health, jobs and economic development, neighborhoods and housing, and arts and culture. Although we've always acted with social justice as a rudder for our work, we will be rolling out a new pathways that will more explicitly support policy programs and people that boldly address systemic inequities in our region. And the Common Start legislation is a large part of that. Thank you. You can go to the next slide now. Great. So this brings us to this report that Danubia, Elizabeth, and I worked on this past winter. So in December, the Boston Foundation released a new paper, When the Bow Breaks, Why Now is the Moment to Invest in Massachusetts' Fragile Childcare System, which documented the dimensions of the childcare crisis, reporting that the number of available seats for young children has fallen by as much as 20% in Massachusetts since the pandemic began, and it's not at all clear if those seats will return, further limiting the access to childcare for young families. Now, I don't need to touch too much on this issue, as many of you on this call, both participating in the audience and speakers, understand that this is a huge issue. We wanted to highlight this report and write this along because it seems that we're all talking about it amongst ourselves, but we're not really sharing the stories and hitting home how much of an issue that this is. This early childhood education and care system is broken, and it will affect us all into our economy and into our health, which is why we're here talking to you all tonight. Now, to speak a little bit more about our programs, our excellent programs that the Boston Foundation supports and invests in, I'll pass it over to Danubia.
Thank you so much, Brianna. Next slide, please. So as you know, our vision for early childhood at the Boston Foundation is that all children in Greater Boston are prepared to thrive in school and life. And as you know, these are the touch points. Usually it's as much as it shows as a straight line, we all know it's not, it's a lot more complex than just those 4 buckets. Next slide, please. So as you can see how the Boston Foundation or the early childhood, how we are, our strategy within to support those buckets and those access points to a healthy start. We have funding pediatric parent engagement. We support a high quality pre-K workforce. And then we also invest in the ecosystem, where we support the proposal and implementation of policies and systems change. We can go to the next slide, please. And these are some of the ways in which we have invested our dollars, right? One of our largest investments is Healthy Steps in Chelsea. Healthy Steps connects right in the pediatric office, specialists to partner with families and explore and understand whether their children are reaching developmental milestones. They assist families to navigate the system and access additional services so that all babies and toddlers have a strong start in life. And we also partnered with Healthcare for All that helped with the waiver for Mass Health. So there are different ways in which we have utilized the funding to support. We have the United Way Shared Services, that is a platform that allows family child care providers to take business classes and different things. Urban College and UMass Boston have professional development opportunities to providers. And within the ecosystem, there's the Birth to 8 network with the Boston Opportunity Agenda that also looks at data and brings the different partners in the sector to understand and address and create policies or advocacy around a lot of the issues that are impacting children and families. And we are partnering with the Massachusetts Early Childhood Funder Collaborative. We're one of the founding partners and part of the steering committee. And we support the Business for Coalition and several research and advocacy, which Brianna mentioned, the most recent one that we funded. And one of the things I want to highlight is since 2019, we have invested in the Harvard Chin School of Public Health in our Ariadne labs to research. And now we are in the co-design and implementation plan to build capacity with a backbone organization to launch a collective impact model that enhances the coordination of community-based social support services for people navigating pregnancy and the transition to parenthood, and mostly the focus in communities of color in Greater Boston. Next slide, please. So why is this that the intersection between health and philanthropy, right? We always think that these services that are going to families are the straight lines. And as we know, in order for you to move between these lines, you got to jump hoops, right? So one of the things that we feel that Build Back Better will do is allow these lanes or lines or threads to be woven, right? And so we can provide this supports and services that will allow children to thrive and allow their families to continue to be the experts of their own child. Next slide, please. And if you want to join the conversation, actually, Brianna, I would like to invite you for this piece. Thank you.
Great. Thank you so much, Danubia. That was excellent. Yes, so as I mentioned before, we invest in programs, as Danubia gave great detail into, policies such as the Common Start legislation, as well as Build Back Better, something I know has been mentioned on this call before, and then also hosting events and reports. So I shared a little bit about when the bow breaks, and we really wanted to continue that conversation from the report. So we've been hosting a series of coffee and conversations about when the bow breaks around this specific interest. And our next one is this Friday. And so we would love for you all to join us, and please register at the link there. And at the TBF website, you can also see past reports, including when the bow breaks. And if you subscribe to our events as well, you'll see a preview of our newsletter that's about to come out in a few days, which supports the Common Start Coalition, the Build Back Better bill, and has an interview with Assistant Speaker Congresswoman Catherine Clark, and hears from her regarding her investments into early childcare as well on the federal level. So it's so important to look at these systems and look at the individual child as well. Thank you all so much.
Thank you so much, Brianna and Danubia. That was great. I'm just a reminder that if you have questions for any of the panelists, please put them in the chat. We're going to ask a few questions and to get the conversation started, but we are happy to take anything from any of the audience members. So Katie, I know you mentioned this a little bit in your talk, but how have you seen the loss of essential healthcare services in Massachusetts, and how do you think this affects especially the early childcare population?
You know, thank you very much. And that was just a really inspiring presentation from the team from the Boston Foundation. I wish I could go to all of these. You know, over about the past decade or so, Massachusetts has seen the closure of over 40 services, units, outright hospitals. And with a heavily, it's been heavily weighted on maternal child health, reproductive health, and behavioral health. And it's in often the most underserved, vulnerable communities. The South Coast, Morton Hospital, other hospitals on the South Coast have closed their maternity units, requiring mothers, again, often mothers of young children in underserved communities, having to travel great distances. And you know, anytime there's a barrier in front of getting prenatal care, often the prenatal care suffers. And so that puts kids behind the 8 ball to start with, even before they're born. And you know what, in Massachusetts, you know, the DPH has the ability to rule on whether a service is essential or not, but it can close anyway. We've seen behavioral health in the western part of the state close down, so that again, people, especially suffering the stresses of the pandemic and even pre-pandemic, can't access mental health services in their own community. And we're seeing this all over the state. And so what happens is the whole family suffers when we don't have access. But focusing on early childhood, so there's less prenatal care, there's less care for the children that are already here with us. And we do all suffer as a society. You know, these children are in our schools requiring extra services. They are more affected by diseases of poverty, and that affects a whole society, you know. And as I did say in my comments, we have the resources to address that. and then we all win. So this closure of essential services that's been really rampant in Massachusetts for a decade or so is affecting all of us negatively.
Thanks, Katie. I think that's, really the goal of the Common Start legislation is to think about how do we set up these families and these kids for success, right? And as you look at kind of all those wraparound services, how that's really instrumental in making sure that they're, that the families have the help that they need and the kids have the healthy environment to really thrive. To just go back to Brianna and Danubia on that, you studied this, you looked at it, there's obviously an issue. How does the Boston Foundation want to look at continuing kind of the equity work in this space? How do you look at what's next steps for you guys?
Absolutely, that's a great question. So we really want to look at the systems. And I think that's what kind of brought us to this conversation in the first place. What's great about the foundation is that we are older, we have really large capacity, we're one of the largest community foundations. So we have many areas of interest. And through this lens of equity and inclusion and systemic change, that's where we're looking at the whole child, like Katie said. So as much as you're looking at the individual child, we're trying to look at the systems involved. So how does the education system affect, where's that intersection with the healthcare system as well? And so with this legislation, we're really pinpointing that as well. And we're really trying to change those systems from the inside out and from the outside down or the top down. And so we'll continue to advocate for the Common Start legislation. We've submitted testimony in the past. We're proud to be part of this coalition and speak to you all here today. And we'll continue to do that to spread our message and to bring more research and convenings, hopefully to the economic side of things, to the health side of things, to the single person who doesn't have kids, but how does this affect you and your economy as well? It is an issue for everybody. It is an equity issue. And so we're really trying to drive that home.
Danubia, I didn't know if you wanted to add anything.
No, she did a great job. And again, it's our job is really to listen to the communities, right? What is on the ground happening? What are we listening? What is like the trending issue that we need to raise awareness and learn more about? And similar to the report that we put out when the bell breaks and in the series of conversations where we're framing the problem, right? What is the problem? Because we keep talking about it, but what is really the problem? It feels like, is it just infusing more money into early childhood? As we know, money doesn't solve everything. We have examples across the board where money needs to be like a sustainable, sustained through a period of time, because one of the things that we were talking today is we love to look at K-12 as they have it all figured out. But sometimes when schools are getting invested because they are not meeting the targets, right? The schools that are failing, we infuse it with all the money and supports and all the resources that they need. When they finally get that score where it needs to be, what happens? Funding goes away and the school goes back to where it was. So those are the things that we need to prevent from happening in early childhood. And we truly feel that the Common Start bill is shining that light in these conversations that were happening in break rooms in childcare centers. There was happening meetings, and even between friends of people who are engaged in the work, that we talked about it. But now we have the opportunity of collectively addressing this issue in an equitable way.
Yeah, I think, I think everything that you guys are saying is really why all of our organizations have been engaged in this work and really do feel like the Common Start legislation is, could really be the solution to all these problems. Or it provides that healthy environment for kids. It provides services to parents. It, on one of the previous roundtables, the parents were talking about how, they had to sign up for childcare before they had to tell their parents that they were having a baby because those spots are so limited. And so, you continue to, and that gets harder as you think about in cities and places where people need it because they don't have an option. They're working, they're going to school, they're juggling many things. And so, they're spending more than half their salary on childcare. Massachusetts has the most expensive childcare. How do we make sure that? And how do we, in order to be successful in K-12, that really does start in that 0 to 5 population. And so, I think a lot of your organizations, the reason you're at the table is because of the long-term health benefits for the kids and for the families and all that provides. Are there anything, as you think about continuing to advocate for this legislation and for this cause? Are there, anything else of ways that you think people should be more engaged? And how else do you think that you and your organizations will really be a leader on this issue?
Well, I'll just add, since I'm already unmuted, I think what the Common Star Coalition does great is, and I mentioned this a little bit before, but driving it home outside of these EEC, early childhood and care conversations, but making it really drive home to business people, to folks without kids, to folks who want to achieve racial justice. This is an issue that affects us all. And so I would encourage folks to continue to talk about this at coffee and conversations, or in reports, or in their own work, but then also talk about it at the dinner table, talk about it to friends who have children and friends who don't, talk about it, how it affects us all and how the economy is collapsing because of this. It's especially affecting women, especially affecting women of color. And that is an issue for all of us. So when we uplift those communities, we can all achieve better results.
Great.
And if I could add a comment, this profession that I'm in is 97% or so female, who are the mothers and the caregivers. And our shifts start at 7 o'clock in the morning. I know so many young nurses with young children who are scrambling for childcare, a neighbor here, a grandparent there, maybe somebody down the street over there. Loving without a doubt, but high quality educational, maybe not so much. We also have shifts that go overnight. Now, people who are new to the country or living, I work at the Brigham and Women's in Boston, plenty of people there need jobs, good paying, secure jobs, maybe working the night shift. These are all things that we have to address. These are, great jobs. I had actually, a secretary left my unit just in the past couple of days, and I asked her why. It was childcare. She said she could get better childcare. She said because of the hours. And so it's as simple as that. And she was wonderful and contributed a lot, but she had to go on to another job just exactly because of this issue. And I'm sure this plays out over and over, or people have to step down from jobs all the time, especially during the pandemic when childcare, all but disappeared. So it's really an economic issue, really is. If we could provide these people who want to work with the support that their children, not only were safe, but were learning, we all win. We all win.
Yeah, I think that's a really good point, because you're talking about, one, the workforce that is teaching these kids is mainly women as well. They need to be paid so that they can make sure that, these are people we entrust with our youngest children, and that they're, providing this kind of stable, healthy environment for a life. And, and I think that's the thing. And the pandemic definitely shone a light on how important it was, how childcare was really, an economic driver, because so many women had to leave the workforce because they had no other choice, right? There was nowhere else for them to have the childcare, or Katie, as you pointed, kind of piecing it together is really, where we need to be. So there's a great comment in the chat that I'll just read. At the same time we are all talking about it, we need to find a way to glamorize it so the ECE programs won't be closing in on higher ed and promoting it as an admirable profession. The field also needs to rethink the delivery system. I completely agree. I think, there's high burnout, they get paid low wages. It's really tough work, and there's high burnout, and there's no, not a huge incentive to go into the field. So how do we make sure that people want to do this, that they want to teach and care for these children, and they want to provide that? And, I think in the Common Start bill, it really does address that, right? It touches the workforce piece, it touches the family wraparound services, and it touches on the need for kids to be able to have this environment. I think that's why it's so important. Thanks, Roz, for that comment. I'll just ask one last question, and then if there's any additional questions in the chat, we'd be happy to answer. And then otherwise, we'll go on to some next steps on how you can help. I think, my last question is, and I think we all touched upon this a little bit in our comments, but why do you believe is needed? What do you believe is needed for our kids to grow up in a healthy environment? Katie, if you want to jump in first.
Oh boy, where to start?
All
a
right, good
different
question.
society? You know, we say we're a family-focused society, but I think that very few of us are under the illusion that we are. And I think that it just, you hit the nail on the head, Allison, when you said the commenter said, we have to elevate these positions. I mean, what could be a greater calling than nurturing and educating the next generation, the people who are going to be making, all the contributions to society. And so I think changing the conversation, I think in every chance we get, in our work communities, in our communities at home, really making sure who gets elected and who sits in the State House, because there are often very many people who will give these activities lip service. And yet, when we're in the State House and we're asking for them to support our bills, like the Common Start bill, sometimes we just don't see the follow through. And I think that we need to really encourage them to make that investment in our future.
Great. Danubia?
Sorry, I was muted. I had unmuted myself early and I forgot that I was still muted. But definitely what Katie said, when she said is like, well, a new society, I'm like, yeah, a whole new planet, right? But since that is not doable, we can only do what we can control. I think that there's a lot. It's quite complex. But one thing that we don't speak a lot about when we are talking about this, family-centered society is that intentional investment in opportunities that allows every adult who interacts with a child to have access to opportunities that allow them to be the higher version of themselves. And these opportunities are often associated with higher wages, right? That will allow these adults and educators and families to invest in their self-care and self-development. And it's also critical to invest. I want to go back to that image that I shared about those lines. Those lines are not straight like that. They're like fragmented, and they're more like a Tetris. I just couldn't find a nice Tetris example to replace those lines. And I just don't have those Photoshop skills to put the Tetris there instead of the lines. But so if we're able to, invest in the fragmentation of the early childhood education and care ecosystem and equitably fund high quality early childhood experiences across all neighborhoods, not just in certain areas, but across, because all children deserve that access. I feel that those would be a good starting points as well. In addition to what we've been mentioning, and the comment on the chat is, why are people staying in these fields? What is understanding what is happening in the field, and getting that information and a two-pronged approach to funding and doing all of that is to change that narrative that actually invites the talent into the field again. Because for a very long time, as we know, these are not livable wages. The conversation is, when you're in high school, even, you don't want to go in early childhood because it doesn't pay you enough.
Yep, 100%. Brianna?
I won't add too much to what Danubia and Katie said, but I will just say, when both of you are speaking and all of us were kind of sharing these experiences and speaking to teacher retention and workforce retention and wage equity, as Danubia pointed out, I just keep thinking about mental health of these professionals throughout this pandemic, mental health of parents throughout this pandemic, or of students themselves. And I wanted to just refocus back into the education, this health intersection of how do we support the mental health supports as well? How do we start investing our dollars, which, the Common Start legislation is a beautiful first step into that, into supporting the whole health of a child, of parents, and of teachers.
Great, thank you. So, hopefully all of you that are listening are now energized and want to, join in if you're not already engaged in Common Start. We're hoping that you will be part of this fantastic coalition and all these great partners. This is, the health is just a piece of this, right? So, you know, certainly join our future roundtables, look for other opportunities. One thing that you can easily do, and Katie mentioned this, is make sure your lawmakers are hearing from you. Make sure that they know that this is important to you, that it's their opportunity to act, it's their opportunity to lead. You know, the more people they hear from, the more it gets harder for them to not act, as Katie mentioned, right? This is really important. Your voice matters, your stories matter. And so I know James is going to put up a petition. It's really easy to join and, you know, work on this. And so you can click on the link. It's in the chat as well as on the slide. You can sign your information. It will match you to your legislators. You can share your stories on this. You can share something that you might have heard from tonight. If you've already reached out to them, reach out to them again. It's really important. The bill is in the Education Committee. It has been extended to June 1st. So it's not given us much time. We know that there is still talks happening in Washington around Build Back Better. And if that funding comes through, Common Start is really the framework for the state to really implement that. It's really important for us to act. There's no better time. You know, the pandemic shone a light on a lot of things, especially around health, but it also shone a huge light on the crisis that early childcare is, and it's really important. So please take a moment to do that. We really appreciate your time and attention tonight. I know people have a lot of activities going on after work, and so you know, we appreciate that you taking the opportunity to listen to us. Thank you again.